Good morning, everyone. Now I am going to discuss a past paper of community health nursing. I am Dimatu Disanayaka. Uh, Today I am going to discuss the past paper of September semester in year 2018. So it's available in the Moodle also. So I am going to discuss only the first 20 questions of the paper since we have limited time. So we'll go to the first question. The question is the main focus of public health practices is towards the health of then you have to fill the next phrase, so next few words. So the main focus of public health practices is towards the health of answer A population, answer B maternal and child health, and answer C senior citizens, answer D school children. When we take all these four answers, so uh, maternal mothers and children and senior citizens, all of them are included in the population. So we focus all these people in public health. So the answer is population. So the answer for the first question is answer A. Its population. The main focus of public health practices is towards the health of population. Now we'll go to the second question. The question is, which of the following are the core functions of public health and form the foundations for public health and community health nursing activities? You know that the core functions of public health includes identification of problems, assessment, policy development, and assurance. So the correct answer is answer A. Now we'll move on to the third question. The question is, as a community health nurse, she has to undertake many roles, especially in the response to the change in factors in health environment. Which of the following knowledge the community nurse needs to have and be aware of? So, answers are answer A, community in the region, lifestyle and the environment. B, the health of total population and emerging of new diseases. C, the latest trend on healthcare and disease management. D, the emerging health trends, health and economic policies. So answer is the emerging health trends, health and economic policies. Now we'll move on to the question number 4. The question is, which of the following division is the heart of public health service at the primary level? So you know that Ministry of Health Malaysia, this question is actually regarding the health system of Malaysia. So the Ministry of Health in Malaysia can be basically divided into the two sections, that is Department of Public Health and other departments. So this Department of Public Health has many divisions. Actually there are four main divisions. So those divisions are Family Health Development Division, Disease Control Division, Health Education Division, and Nutrition Division. So Family Health Development Division is responsible for running and developing the strategy, the various policies for implementation, as well as monitoring the progress of the project's activities at the grassroots level of the individual and family. So the Family Health Development Division concerns about the maternal health, perinatal, neonatal and child health, adolescent health, women and adult malnu- women's and adult mental health, um, elderly health, and rehabilitation services and special needs. So each of these branches has its own objectives and activities. So answer for the fourth question is answer C, the Family Health Development Division. So Family Health Development Division is the heart of public health service at the primary level. Question number 5. Which of the following is the main focus of public health discipline? Answer A, prevention activities. Answer B, curative activities. Answer C, detection activities. And answer D, rehabilitation activities. So the main focus of public health include, that the prevention of diseases and promotion of health is the main focus of public health. So answer is clear. Answer is answer A, prevention activities. Now we'll go to the question number 6. Which of the following is the main activity of public health nurses in Malaysia? So, the main activity of public health nurses in Malaysia is to provide personalized care or the individualized care in the designated area. So, answer is answer A for sixth question. Now we'll move on to the seventh question. Question is, the first year nursing student is reading about community health care and ask question, what community health workers refer to? Which of the following is the best response? Answer A, a group of professionals working together to improve the health of community. Answer B, health professionals who work to improve the health of a community. Answer C, community health nurses who work to improve the health of a community. Answer D, community health nurses and clinicians work to improve the health of a community. So you know that community health care work community health workers are not only the healthcare professionals, the various other professionals also involved with community health. So several social workers and other professionals in various other fields, they involve in community health. So you cannot say these workers are only belongs to the health field. So the best definition is a group of professionals working together to improve the health of a community. So the answer for seventh question is answer A. Now we'll go to the eighth question. The question is, which of the following is the most important role of a community health nurse in the epidemiology? You know that epidemiology means study about the population. So, if you want to study about the population, you need to assess the population first. That means you have to collect the information related to the particular population. So uh, so so this systematic collection of data we call as surveillance. So the most important role of the community health nurse in epidemiology is to perform disease surveillance. So answer is answer C for the eighth question. Then question 9. The family health sector is responsible for to plan and implement the following programs except answer A maternal health, answer B perinatal, neonatal and child health, answer C women and men health, answer D spiritual health. If you can remember, so I explained in question number 4 this family health development division as 6 subsections. So these subsections or the branches has different responsibilities. So these 6 branches are involved with maternal health, perinatal, neonatal and child health, adolescent health, women and adult men health, elderly health and rehabilitation services. So answer for question 9 is answer D, spiritual health. Except spiritual health, this family health development division in Malaysia is responsible for the others health. Now we'll move on to the 10th question. The question is, the rural health centers under Ministry of Health Malaysia become more structured ever since 1960s. Which of the changes take place? Answer A. The tier system of 3-level services of rural health units was changed to 2-tier system. Answer B. The tier system of 3-level services of rural units was changed to no-tier system. Answer C. The tier system of 3-level services of rural health units was changed to 4-tier system. And answer D. The tier system of 3-level services of rural health units was changed to 5-tier system. So you know that these tier systems are the 3 levels of rural health services. So these 3 levels are main health centers, health sub-centers and midwifery clinics. So this main health center has one main health center has 4 health sub-centers, and each health sub-centers, 4 midwifery clinics are running. So the change that took place was this 3-tier system changed to 2-tier system. So the answer is answer A. Now we'll move on to the 11th question. The question is, which of following services remained the main component of National Rural Health Development Program in Malaysia? So, you know that health system exists in Malaysia when Malaysia gained independence in 1957 was urban based, and this system failed to meet the health needs of the rural population. So the extensive development of health infrastructure facilities was initiated under National Rural Health Development Program. So the maternal and child health services remained as the main component of National Rural Health Development Program. So answer is answer A, maternal and child health services. Question number 12. Which of the following is the indicator of the health status of a country? Answer A, proportion of obesity among 12-year-old. Answer B, high employment rate yearly. Answer C, low socio-economic household income. Answer D, infant and maternal mortality rate. You know that health indicators are the indicators of the health status of a country. So these health indicators include life expectancy, maternal mortality rate, infant mortality rate, neonatal mortality rate. So answer is answer D, infant and maternal mortality rate. These are some of the indicators of the health status of a country. Question number 13. Which of the following is the ultimate goal of primary health care? So, you know that primary health care concept was initiated by World Health Organization and its member countries. So this concept, public health concept, was developed in was explained in Alma-Ata Declaration. So primary goal of the public primary health care is better health care for all. So, to achieve this goal, WHO identified 5 key elements. So, these elements include first one, reducing exclusion and social disparity in health. Second element, organizing health services around people's needs and expectations. Third, integrating health into all sectors. Fourth, pursuing collaborative models of policy dialogue. And fifth, increasing stakeholder participation. So, answer for 13th questions is answer C, promote better health for all. That is the ultimate goal of primary health care. Question number 14. What type of approach the primary health care in Malaysia used in providing population-based services? So they use life course approach, which means the services are they provide services from womb to tomb. That means from not actually from birth. So when the person is inside the mother's womb till he goes to the death. So answer is answer A, life course approach in delivering services from womb to tomb. Question number 15. Which of the following is the main aim of Safe Motherhood initiative that was launched by WHO in 1987? So you know that these Safe Motherhood programs initiated with the aim of reducing maternal mortality in developing countries. So, answer is answer D. Reduce the maternal mortality in developing countries. So mistakenly answer C has highlighted. So answer C is not the correct answer for 15th question. The correct answer for 15th question is answer D. Answer is reduced maternal mortality in developing countries. Question number 16. What is the first goal of Millennium Development Goal established in year 2000? So, you know that Millennium Development Goals are 8 international developmental goals that were established in 2000 to be achieved by 2015. So, these goals include: first one, eradicate extreme poverty and hunger. Second, achieve universal primary education. Third, promote gender equality and empower women. Fourth, reduce child mortality. Fifth, improve maternal health. Sixth, combat HIV/AIDS, malaria and other diseases. Seventh, ensure environmental sustainability. Eighth, global partnership for development. So answer for this question is answer A. Eradicate extreme poverty and hunger in the world by 2015. So most of the countries in the world, they couldn't achieve these goals, so they couldn't fulfill these goals by 2015. Now they are looking for sustainable developmental goals which are to be achieved by 2030. Question number 17. Which of the following is the meaning of community health nursing? So, there are various definitions. So, according to Clark 2003, community health nursing is a synthesis of nursing knowledge and practice and the science and practice of public health implemented via systematic use of the nursing process and other processes designed to promote health and prevent illness in population groups. So answer for 17th question is answer A. The synthesis of nursing knowledge, practice, the science and practice of public health. Question number 18. Why the scope and standards of practice of community health nurse is important? So, actually, why we need standards? We need standards to provide quality care or to increase the quality of our care. So the best answer for the question is it provides useful guide in nursing practices within a community and the implications. So the frameworks is a useful guide in delivering services within a community and at the same time provides challenges for community health nurses. So answer is answer C for 18th question. Question number 19. Why community health nurse needs to understand the concept, trends in healthcare delivery, underlying community health practices. So you know that what are the health trends exist in our community. So you know that the demographics like age is changing, age, gender is changing. So now we can see because of this development of health, we can see the mortality rate has gone down. So uh, the life expectancy of the community, life expectancy of the people is going up. So the we can see the uh, elderly population is gradually rising. So that is one change. One changing changes of demographics. And then you know that now the disease patterns also changing. So earlier in ancient at past in the past, so there were a lot of communicable diseases and people died due to these communicable diseases. But nowadays it has changed. So the non-communicable disease rate is very high in the community, and now the people are dying due to non-communicable diseases or the chronic illnesses. So answer for question 19 is answer A. It relates to change in demographics, change in disease pattern, and increase in chronic illness. Then move on to the last question, question number 20. Last question I am going to discuss. What do you understand on standard 1 of core standards of care for community health nursing? So, these core standards of care include 6 standards. Those standards are: first one, assessment; second, diagnosis; third, outcome identification; fourth, planning; fifth, assurance; and sixth, evaluation. So this assessment means the assessment of health status of the population using data, community resource and community resource identification. So answer for 20th question is answer B. So I think you can go through the rest of the paper. So answers are highlighted. And if you have any questions or any doubt, you can clear by discussing with us. And you know that this paper, community health nursing paper, is little bit different from other papers, and it is somewhat difficult compared to the other papers. Because so what you have to do is, before coming to the exam, you have to go through whole book from A to Z before you come sit for the exam. So uh, when we look at the past papers, we saw that very small points also they have asked for questions. So what you have to, the best thing you have to do is, you have to consciously read the book from A to Z at least once before you come to the exam. So good luck for your exams. Thank you.